Hi there, I'm Dr. Stephen Iacoboni at Causenta Cancer Care Center here in Scottsdale. It's great to be here today. I'm here to answer some commonly asked questions that are sort of myths about breast cancer, as this is Breast Cancer Awareness Month. Sometimes I'm asked about deodorant, and I can tell you that there's no reason to worry about deodorant causing an increased risk in breast cancer. So sometimes I've asked about whether men can get breast cancer. The fact is yes. The incidence is 1% of all breast cancers are male. So it's an uncommon or rare disease in men, but it does happen. And so if you're a man and you have a lump in your breast, you shouldn't ignore it. You should get it checked out. 99% of the time breast cancer occurs in women, but men can get breast cancer. One common myth is that not having children somehow protects you against breast cancer. And actually the opposite is true. The more children you have and the younger you start having children, the less likely you are to have breast cancer. That's why nuns get breast cancer more frequently than any other group that you can think of. And unfortunately, it's just a socioeconomic fact that over the past 30 years or so in our society, more and more women have entered the professional workplace and are not in a position to have children until they're 29, 30, and they may have fewer children. And this actually does account for the rise in breast cancer incidence in the Western world. Pregnancy protects against breast cancer, and the absence of pregnancy and the absence of delivering a child full term is a risk for breast cancer. One of the common misconceptions is that there's something wrong with getting a mammogram. I'm sometimes surprised when I hear that. I think there is sort of a rationale that compressing the breast might move cells around and that sort of thing. But the fact is that mammograms are about as harmless as eating a piece of toast. And hundreds of millions of mammograms have been performed in the United States alone. And there is absolutely no risk from getting a mammogram. And in fact, the risk is if you don't get one and you don't do your screening and you don't catch your cancer when it's early, that's really where the problem is. One of the peculiarities about breast cancer that most people don't completely understand is that the risk goes up progressively with age on into your 90s. And so there are very few women who get breast cancer under the age of 30. In fact, I would say that's rare. And it's very uncommon to get breast cancer when you're in your 30s. Breast cancer starts creeping into the population even uncommonly in the 40s, and then it becomes more common in the 50s. As women age, the risk of breast cancer goes up year after year for the rest of your life. Now, if you're 85, do you have to worry about it? Well, one of the nice things is if you get breast cancer at that age, it will probably not be very aggressive. And so sometimes for elderly women who have other health issues going on, we may actually cut back their mammogram to every 2 years, as long as they're doing breast self-exam and getting annual physicals. But breast cancer risk does not go away with age. It's a lot like heart disease. The longer you live, the longer there's a chance that something might happen. Well, that concludes our questions for this week. I hope that the answers have been helpful to you. If you have any other questions, we'd love to hear from you, either by calling our office, Causenta Cancer Center in Scottsdale, or by email. And I look forward to sharing more answers to commonly asked questions about breast cancer in next week's video.